My next speaker that I'm very happy to introduce is Simran Dhunna. She is an MPH Epidemiology candidate at the University of Toronto and an organizer with Climate Justice Toronto and Climate Justice Peel. And she's also an intern with the Canadian Centre for Policy Alternatives. So with that, I'll hand it over to Simran. Thanks so much, Simran.
Hi, thanks Pam for introducing me. Hi everyone, my name's Simran, and I'm going to be talking a little bit about the labor conditions of frontline, as well as specifically frontline healthcare workers. And I say frontline because not only are frontline healthcare workers face-to-face with the coronavirus pandemic, but frontline workers are in a healthcare crisis themselves, and they are strong determinants of the outcomes of the pandemic and bear the brunt of it. So I'm going to be talking about their labor conditions and who makes up workers in these sectors, and pulling from research from the CCPA, who I'm currently working for, but I'm not representing in the talk. So with frontline workers, I think we're all hearing all these stories about, every evening in some parts of Toronto, people are banging their pots and pans. But it's important to remember who these frontline workers are, not just grocery store cashiers, but warehouse workers, couriers, cleaners, sanitation workers, TTC drivers, meat packaging plant workers, all these workers who are also behind the scenes and are really vehicles of a healthcare crisis as well, and who are themselves have not consented to their labor conditions. Their labor conditions include, as we've all heard, inadequate PPE at a time when both federal and provincial governments have let millions of N95 masks expire. And the expectation for a lot of these workers is to bring in that public health material themselves into the workplace. They're also dealing with inadequate pay. Workers in most of these essential industries are earning far below the industrial average income. So for instance, grocery store workers who are not only facing the violence of capitalism, but also oftentimes harassment from customers who are themselves in desperate and dire circumstances. They're earning 50% of the industrial income. Cashiers are earning 26% of the occupational average income. Light duty cleaners are earning 42% of the occupational income. So clearly what people are earning is not proportionate to the risk that they're in and the work that they're doing and the labor that they're extending. And often these workers are getting less than what people who are eligible for CURB are getting. But more importantly, a lot of so-called essential workers who have always been essential to our economy are working at places where the power remains skewed on the side of the bosses. These are workers who aren't unionized. And we're seeing that workers who are resisting, TTC workers, sanitation workers, oftentimes are unionized because they have the confidence and the backing of their union, which of course emphasizes the need to have consistent labor and union standards for all workers. Now, specifically in this sector or this category of essential workers, we are hearing a lot, as Fez described, care workers in the long-term care sector who are really directly in the trenches. And I hate using war ideology, but it works right now. And specifically personal support workers who are going home from home, workplace to workplace, because working at one facility isn't cutting it for them in order for them to pay their bills. So they're also not given adequate PPE. They're also dealing with low pay, precarious working conditions. And like Fez said, this is a long-term trend. For decades, staffing has been decreasing in the long-term care sector and for PSWs. This is not work that people want to do because they know that they're not respected and valued in their workplaces, and it's not reflected in their paycheck. And advocates in that industry have been calling for full-time unionized work for all workers among the long-term care sector for a really long time. And, I found it interesting that François Legault, the Premier of Quebec, recently said, I should have hiked long-term care workers' salaries long ago. So it's interesting that there's some perceived self-reflection that's going on here. And meanwhile, in Ontario, you have the Ford government that's being asked to take control of long-term care homes, and they're refusing to do that. So there's a lot of pressure on our governments to improve the working conditions and wages of workers in the care economy. And so it's a really good time to really be pushing on that. it's a really good time to be pushing back on even previous legislation that the Ford government has implemented, like Bill 124, which limits all nonprofit public sector employees to 1% compensation cap, right? So for SEIU healthcare frontline workers at a nonprofit LTC facility in Richmond Hill, 100 of them were on the verge of negotiating wage increases. And they actually lost that. They lost 32 cents per hour, even though their bosses were willing to pay them that amount, PSWs. So we're seeing that this is a trend, this is happening, and now those cuts are catching up to us, and they've always been catching up to us. And in this care economy, alongside PSWs, long-term care workers, it's also important to remember the workers who are also doing the care work of caring for essential workers' children in childcare, as well as people who are doing harm reduction work on the streets or in the shelters and other group spaces who are also doing care work, but it's not regarded as such by the healthcare sector. So finally, who are these workers? I think it's really important to remember that when we talk about austerity, when we talk about cuts to healthcare, those are fundamentally cuts to the living conditions and an affront to the dignity of women, of racialized workers and migrants. The vast majority of workers in frontline care work, especially, are women. And particularly racialized women in the long-term and home care sector make up more than twice the share of their Ontario workforce. Or even women who are nursing aides, orderlies, patient service associates, as well as home support workers. Racialized workers are 3 times the share of the Ontario workforce. And specifically, Black women, Black people make up 14% of all workers as nurse aides, orderlies, and patient associates, as opposed to being 4.3% of the workforce overall in Ontario, which is stunning, right? Because this is not something that's being talked about. This is not something that's being even reflected in news stories about who these workers are when they're being interviewed. What are they struggling through, and what are their experiences as racialized women, as Black women in this system right now? And they're also migrants. There was a press conference just this week by the Migrant Workers Alliance for Change, by Migrant Rights Network, that talked about undocumented workers and the work that they're doing to do care work, to clean our buildings, and being denied access to income supports. And a lot of these women are doing care work in the long-term care sector as PSWs. And it's important to remember that a long time ago, when migrant women were coming through the caregiver program by Canada, those women used to be white European women and were given status upon arrival. And as soon as Canada decided we want these women to be Black women from the Caribbean or Filipino women from the Philippines, that was denied to them. So really important to remember this lens that is often neglected by the media and by political representatives. And ultimately, at the end of the day, when we kind of raise the working conditions, when we give everyone paid sick days, when we increase the wages of the most vulnerable frontline workers, the most vulnerable care workers, we are raising the working conditions and wages of everyone. And we really need to not only protect the frontline, but we also need to deny the rich access to loading up their bottom line. And we're talking about employers who absolutely have it in them to increase workers' wages and to match their degree of risk and work to what they're actually doing. And it's a really good time to really be pushing for that on all fronts. Thanks.
The next speaker is Simran. So if you would like to give us your closing remarks, that would be fantastic. I'll unmute you now.
Thanks, Pam. And thanks to all the speakers. I've learned so much from both the speakers and people who shared any thoughts and insight afterwards from the front lines. I just briefly want to speak to what you were saying, Pam, about equal pay for equal work. I'm thinking a lot about, policy changes that are happening right now in the long-term care sector that could happen. There's a big opportunity window right now. But I'm also thinking about temp agency workers who are in the long-term care sector, and they're supposedly less than 2% of PSWs, RNs, RPNs in the long-term care sector. we don't really have a sense of the numbers very well because they're not measured very well. But these are staff who are in long-term care facilities who are also doing housekeeping and food service work. And I'm actually thinking a lot about how those are workers who are, for instance, excluded from Ford's directive that PSWs or long-term care workers only work at one facility. So I think one thing to remember as we organize moving forward is to not allow the state to entrench an underclass of more precarious workers who are further segmented and who are disproportionately racialized and migrants. And to really push back on these loopholes and to make sure that any kind of wins that we have are universally applied to everyone in the sector. And I think it's really interesting that the Ministry of Long-Term Care said that they've allowed for this loophole to ensure a steady supply of staff. And so really that gives insight into how the government views certain staff, certain workers as disposable, and continuing to push for equal pay for equal work means that we push back on that disposability. And I think that's really important. The other thing is really ensuring that any type of funding that comes through from the federal government to the province now, it's so easy for them to just send that money directly to employers, like they did for temporary foreign agricultural workers, sending money directly to the farmers instead of the workers. So I think as we see the government kind of feeling the pressure from the public to support frontline workers, making sure that we're centering the workers in that pipeline of money that's being funneled to them. And finally, I think I'm reflecting a lot on just the care economy and how we have a broader tendency to isolate the elderly, isolate people who are disabled, who have intellectual disabilities in these homes. And I think this is a broader discussion that we need to have in the healthcare sector and broadly as a public, and how we integrate our most vulnerable to make sure they're not separated in these facilities where, as a public and as a collective, we just turn our eye, a blind eye on them, or turn away, and it's easier for those people to be silenced. So I think it's worth also thinking about what are alternative forms of care and alternative publicly owned institutions that we can forge and start thinking about as a group. Thank you.
Amazing. Thanks so much.